Sitaram. Good morning and welcome to our regular Thursday morning uh, session on addiction and recovery. My name is Ramnaresh Dwarika, as you see, and I would like to welcome all our listeners, both in Trinidad and Tobago and worldwide, and to let our listeners know that this is an interactive program. You are welcome to call at any time during the program. You can call 663-2335 or 663-1027. You may also text me at 768-5925 if you have any questions, and I'll try to respond to them as soon as possible. And this program is being recorded. It will also be posted on YouTube soon after the program and on Facebook. It will also be repeated on the same platform, Radio and TV Jagriti, at 10 p.m. tonight. So those of you who are unable to listen to the program in its entirety, you can always come back and look at it. And you may also refer or send a link to other people from YouTube and Facebook that you believe might benefit from the discussions we are having here. I'd like to encourage our listeners to call if you have questions and or short comments, or text your messages in. So this morning, I want to thank Francis and all the people at the television station for doing the research and presenting so much very important information, the 8 essentials of staying sober in recovery, and also that very, very informative piece on acupuncture, which prompted in my mind, being an acupuncturist myself, it took me down memory lane. Way back in 1992, I was employed at Cora Hospital as a psychiatric social worker there. And as most of you who follow this program would be aware, I'm also a person in recovery. I'm now a little over 40 years since I've had my last drink or cigarette or any one of those drugs, psychotropic drugs. So I've always had a passion for working in this field and helping people who might have a problem with alcoholism and drug addiction. And it came to my knowledge that there was a gentleman named John Tyndall from London, from Liverpool in England, who was down here, and he was teaching auricular acupuncture to participants here at the Jean Pierre Sports Complex. And some of my staff, nurses attached to the Substance Abuse Treatment Center, had gone to visit, to attend that training program. I myself, with another colleague, was headed to St. Anne's Hospital. And when I heard of this, I literally made a beeline. I said, no, I have to go and see. What was happening. What acupuncture has to do with drug addiction. Being a person in recovery, I was curious because prior to that, I had worked at Ward 8 in Port of Spain General Hospital. I had worked at St. Anne's Hospital. And I have, seen what is happening, observed firsthand how we treat alcoholism and drug addiction. And that has largely remained the same even as I speak today. If a person goes into a treatment facility worldwide, in the United States, in several places, and indeed in Trinidad, one of the standard treatment is what we call Valium and vitamins. They give you sleeping pills, Valium, and they will give you vitamins, because most people, when they get into a treatment facility, they are emaciated, they have not been eating well, they have not been taking care of their bodies. And one of the main withdrawal symptoms of alcoholism and some of the other drug addiction, the sedative addiction and so on, is insomnia. People who attempt to stop drinking usually have a great difficulty to sleep. Some of them become very depressed and anxious as well. So sedatives and tranquilizers and uh, a lot of medication are used. The problem with those is that these, to come off medication, a lot of people eventually they substitute. Instead of, okay, they're not taking the alcohol, but they start becoming dependent on the sleeping pills and the anti-anxiolytics. And that, from my experience, can land you up with a worst situation. Because I'll tell you something from experience. I've been in this field for over 40 years. And it is several times more difficult to come off prescription pill addiction than it is to come off the illicit drugs, cocaine, marijuana, and alcohol, and all of those. So that what I have been seeing and what I saw then was that what we were doing literally was substituting one drug for another. And that really does not translate to recovery, because the psychotropic drugs, the sleeping pills, the barbiturates, and the anti-anxiolytics, these are much more addictive. And a lot of people become dependent on them for the rest of their life. And what happens with time, it is a social thing where a lot of patients, and I'm not blaming the doctors here, let me say up front, because the person has to get sleep. They have to be sedated. The withdrawal symptoms have to be dealt with. But Trinidadians generally, I have found from working in the field, they quickly read the name of the medication. And although the doctors may have worked out an exit plan for them, after you come out of treatment, you should only use this and wean yourself off it, and start depending on other things like eating properly, exercise, going to support groups, learning coping skills, and all of that, and not become dependent on the psychotropic drugs. However, a lot of people, they don't follow the advice. They don't go to the AA meetings, and they just decide, well, look, there's another shortcut here, and a more potent one. And they go and buy the drugs under the counter, and they start using it. And what happens, and I've said this many times in different ways on this program, once you start using a drug, a psychotropic drug, a mood altering substance, you develop tolerance. And where 5 milligrams would have put you to sleep initially, now you have to take, after a little while, 5 milligrams is not working. You have to take 10, you have to take 15. And I have dealt with people here who have been taking, well, horrendous amounts of drugs, sleeping pills, in order to be able to sleep. And let me say up front, when you take these drugs, you're really not sleeping. When you wake up, anyone who takes these drugs, when they wake up the next day, they will tell you that they never feel rested. They feel like they were beaten up all night, because it is not natural sleep. It's really artificial. And having worked in the psychiatric departments at Port of Spain, St. John's, now at Cora, having the experience working in the field with alcoholics and drug addicts, and having that first-hand experience, I realized that taking pills, taking psychotropic drugs as a substitute, is not the solution. In fact, it creates a bigger problem. Because what I have been seeing in my practice here is a lot of people showing up now who were put on prescription pills by their doctor. And when they develop tolerance and the prescription pills were not working, they go back to using alcohol to substitute it. And that is a dangerous combination, because, I mean, a lot of people have died because of overdose, because when they did the research with the drug, they never really calibrated it alongside using other substances like marijuana, cocaine, alcohol, and so on. So it's very easy for a person to overdose on these things. However, coming back to what was presented earlier on, the acupuncture, eventually I attended the session, And I had a lot of questions. You know, um, what I saw there was 5 little needles were being put on the air, and the needles did not actually puncture the air. They just wrapped in the skin. There was no bleeding or such. Very rare you might have a little breaking of the skin. Now, I have been using this procedure since 1992 with patients. I had introduced it at Cora following that training session. But coming back to the training session, I could not understand how putting 5 needles on a person is, what that had to do with drinking or drug use. But then on further examination, I've come to realize that the air, if someone, any of you listening, if you look at a person's air, you'll see the air is like a fetus upside down. I have one in my office here that clearly illustrates, and all the organs of the body are distributed on the air just like it is in the body. So there's a ridge running on your air. If you run your fingers on it, you can actually feel the joints of your vertebrae, the spine is represented on your air. So I have since then been trained as an auricular acupuncture specialist, certified to do auricular acupuncture, but also certified to teach it. I have trained many practitioners at New Life Ministries and other places up the islands in the procedure of how to administer auricular acupuncture. But it also allows a person to make diagnosis. We have since science has now been able to establish, as you saw in the lead up to this program, and verify the effectiveness of acupuncture in treating so many other conditions. Now we know that the hands, the palm of the hands, the sole of the feet, there's what you call reflexology, where people who are trained can actually treat a person by finding certain points and stimulating them on the palm of the hands or the sole of the feet. But science has even gone further to establish with the DNA studies and so on. Now, science has realized that one single cell that is so microscopic that you can't see with the naked eye. A single cell has more information, I would say, than the human brain, which is so much bigger. Can you imagine with a single cell, the scientists can now clone, it was done with sheep, they can clone an exact copy of that sheep, that animal. And they can do it with human beings, but it was considered unethical as a result. Well, we are not aware whether it has been done, but it goes without saying, there's no doubt that it can be done. Imagine one single cell has all the information about the person, not only the physical attributes, the genetic information, the ethnicity, the ancestry, all the information is contained. The habits and mannerisms and all of that we inherit from our ancestors were transferred by a single cell at the time of conception. It had all the information, and it can also include information not only from the the paternal side of the family, but also from the maternal side. So now, with the trained eye of a professional, one can look at the air. I use the air to do diagnosis. Of course, I listen to the patient, but I can also verify what they are saying by examining the air and the hands, so that you can verify what the patient is saying to you. Now, how does that tie in with drug addiction and alcoholism? The fact of the matter is that, like I mentioned before, the old method and the method that's still being used by allopathic medicine is to use chemotherapy to deal with withdrawal symptoms and to deal with ongoing situations of depression and anxiety and so on. And these, in most cases, leads to the dependence on the drug and the tolerance and the having to take more and take more often and all of that. However, the advantage with acupuncture is that you can't get addicted to it. It does not give you a high. When you have the acupuncture, in the auricular acupuncture protocol, 5 little needles are placed on the ear. One is placed at a point called Shen Men, which is actually corresponding with the base of the spine, which in yoga, for those who practice yoga and teach yoga, know it is the Muladhara chakra. And once you put that needle there, if you just use that needle alone, one needle, immediately the person starts becoming more relaxed. In fact, where I have patients in the past who might have been reluctant and afraid of needles, and I got them to agree to just try one, that is the point I would stimulate, and immediately it is not painful. You know, a lot of our population here have had a very bad impression of needles because of our experience with injections. You know, you go to the casualty, you go to the hospital or the health center, and the nurse is going to administer an injection. And, you know, unfortunately, a lot of these nurses sometimes, I don't mean to criticize them, but they would be drawing up the medicine and, you know, kind of spraying a little bit right there in the presence of the patient. And, you know, while the person is just pumping you take the air out of the the hypodermic needle, you sitting there looking, you're already feeling pain, you know, it's psychological. So that when they come to, and the injection needles literally are very thick needles, you know, because they have a tube to pump the medicine through. And the front of it is made very sharp. So it actually cuts into the tissue when it goes in. And having to pump the medicine, of course, creates a certain amount of pain as well. This foreign substance, you know, penetrating all your cells and so on. So that experience has led a lot of people. I had a gentleman who came to me this week who, at age 60 something, he's never had acupuncture before and he was mortally afraid of needles. And after one treatment, he's no longer, he will recommend it to anyone. And I'll probably talk a little bit about the needling skill, just so that all those people who are listening and who think about having acupuncture as a modality to treat their condition, but they're afraid of needles, I'll speak a little bit more about that. But coming back to the auricular acupuncture, the first needle is put at the base of the spine point, Shen Men, which immediately causes the person to relax. You can actually see the relaxation. Some people tell you right away, they start feeling sleepy. Um, then the other needles, the other 4 needles, one is put on what is called a sympathetic point. That has to do with anxiety and depression. So when you put it there, if the person is suffering with anxiety or depression, it brings them into balance. It doesn't give you a high, but it brings the body into balance. And then the other 3 needles, one is put on the kidney point, which is right in line with the Shenmen. And the other needle is placed at the liver point, and the third last needle is placed on the upper lung on one side and the lower lung on the other side. These 5 needles, literally in acupuncture, it represents the 5 points represent the 5 elements that the body is made up of, the air and the fire and the wood element and all of those. So literally what it does, it brings the whole body into balance. This same treatment was originally used to treat people who were overweight in Hong Kong. And because it was found that a lot of people who are depressed or anxious, they have a tendency to do what is called comfort eating. And when you use this method, they became less anxious, less depressed and all. And if they had the desire to go on a diet and have the discipline to maintain it with counseling and support, they were able to successfully develop and follow the plan, stick with their plan and lose the weight. So too with drug addiction, those people who had a desire and they're highly motivated, the acupuncture relieves all the withdrawal symptoms, the insomnia, the depression, the anxiety, the irritability, all of those things are relieved so that if the person is motivated and they are counseled. Now, acupuncture, let me say this, by itself is a useful adjunct, but it is not a cure for drug addiction. But a lot of people who are well motivated, has good insight, are unable to stop because of the withdrawal symptoms. You know, next day they're trembling, they're getting the shakes, they don't have any appetite, they can't sleep in the night, they become anxious and irritable and depressed. And because of those things and not being able to cope with it, they go back and use the drugs. But with the acupuncture, they have a very, very good chance now. Once they are highly motivated, they go to the AA meetings and they follow their plan, you know, in their support group and so on, they are very successful. Now, the point I'm making here, one of the important things is that you cannot get addicted to acupuncture. And this is why acupuncture has a definite advantage over the conventional methods, because in the conventional methods, you are introduced to a psychotropic drug to tide you over while you're in withdrawal. And yes, it will relieve the withdrawal, but it has the tendency to become much more addictive than the drug for which you were originally prescribed. And this is definitely one of the advantages of using acupuncture, is that you can't get addicted. Secondly, it is very, very cost effective, because an acupuncturist can you don't need any you know great set of qualifications. You have to, yes, you have to do the training, you have to understand the methodology, and you have to be able to counsel your patients and so on. You need to understand drug addiction or whatever purposes you're using it for. So that it was used at Cora, it still continues to be used at New Life Ministries, that is Mount St. Benedict, and very effectively. Now, there are other advantages to acupuncture. I know I had my teacher on this program some time ago in the past, Mr. John Tyndall, who spoke about the various aspects of acupuncture, but I thought I would relate it to our local situation here so that people, originally I was trained in auricular acupuncture, that is acupuncture, the 5 needles on the ears, but I have followed up by training myself and attending training for generalized acupuncture. So now I can treat not only drug addiction, but I do treat various other body conditions like lower back pain and pains generally in the body, strokes. Acupuncture has been found to be very effective in treating strokes because it stimulates the nerves from the other end. Traditional medicine, generally what they seek to do is to control the high blood pressure and prevent a recurrence of the stroke. But after 2 days, there's very little conventional medicine can do to reverse the effects of a stroke. But acupuncture has been found to assist greatly in that. I have had very good results in that regard. But coming back to drug addiction, again, the auricular acupuncture has an advantage in that you don't have to believe in it for it to work. It is not like church. Whether you believe in it or not, it will work. So it has been found to be useful with the mentally ill and chemically addicted populations. Now, there's a lot of people. Last week, I spoke about substance abuse and suicide, because substance abuse can lead to mental illness, which can lead to suicide, because people become so depressed, so anxious, they become suicidal. And so there's a very close relationship between mental illness and drug addiction. Mental illness can lead to drug addiction because you become dependent on psychotropic drugs. But drug addiction can also lead to mental illness. In fact, when I work at St. Anne's Hospital, I saw a lot of young people, and anyone visiting there, you'd see a lot of young people who are there with what is called drug-induced psychosis. And that is especially because of marijuana use. So that I know I have spoken about the relationship between marijuana use and drug-induced psychosis in past programs. I have all of these programs are listed on YouTube under my name, Ramnaresh Dwarika, Addiction and Recovery. So you can go and you can skim through them on various aspects of alcoholism, drug addiction, recovery, relapse prevention. Today I'm speaking about acupuncture. So coming back to the whole question of acupuncture, this was way back in 1992 when I was introduced it by uh, Mr. John Tyndall at Gene Peer Complex. I came back to Cora at the time. We had some amount of difficulty to introduce it there. There was quite a lot of resistance at first from the staff and so on, because this was something new. But then eventually, Dr. Lewis, who had been to a CICAD conference in South America, Argentina, I think, he heard about the use of acupuncture from other people who were participants who were attending from Europe and North America. And when he came back, he took responsibility for the acupuncture program, and the program took off from there. And we now were treating the inpatients, the outpatients very successfully with acupuncture. Again, to remind you, it is not a cure for drug addiction, but it is a very useful tool. If a person wants to stop using drugs, that acupuncture can help them relieve the craving for the drug, because the craving usually stems from the withdrawal symptoms that happens because of prolonged use of alcohol. Now, for people out there practicing, practitioners, you know, if a person is over 40 years of age and they have demonstrated withdrawal symptoms that include hallucinations, it is called delirium tremens, then acupuncture may not be the most appropriate. For patients like that, they will need to be taken into a safe environment where they could be detoxed under supervision. Because a lot of people over 40, delirium tremens is a situation where the person, when they go into withdrawal, when the alcohol is wearing away from them, the next day they start hallucinating, and they usually see, like, things are coming to harm them, people are coming to hurt them, snakes or animals are coming to harm them, and they become very scared. And I have seen at least one or two instances personally. I was in a bus going to Granville once, and there's this elderly guy who was from the community, and he was in the excursion, but he had drunk the night before, and now he was going through withdrawal. And this man jumped out of the bus window while the bus was moving when on the on the Saifu trace in Granville, and we had to stop the bus, and some of the other men ran into the bushes. It was a cocoa field, and found him. He climbed up a cocoa tree and was hiding, and said, insisting that there were people after him to kill him. Now, that kind of fear put so much pressure on the cardiac system that a lot of people can go into heart attack. They can suffer cardiac failure and die. And this is why I was saying, for people like that, they have to go into a controlled environment, a hospital, where they can be supervised under, you know, professional supervision, where in some instances, chemotherapy may have to be used to tide them over until they get over the withdrawal from the DTs. I see I have two questions coming in. What risks are associated with acupuncture? Yes, and that is a very important question. It is important that acupuncturists use sterile needles, because especially with AIDS and all the other viruses around, even the COVID and all of that, you don't want to use the same needles on different people without it being sterilized. So that at Cora Hospital, what we did, since we didn't have the money to buy new needles, we would collect the needles after each session. The patients themselves will take it off and put it in a container with methylated spirits. And then one of the nursing assistants would take the needles and put it in gauze and then put it in what is called autoclave paper. It will be sent to the autoclave machine system in the hospital that sterilizes all the surgical instruments. And usually it is sterilized, and usually when it comes out, one can tell. Professionals who nurses and doctors know that when it comes out of the autoclaves sterilized, there are lines visible on the autoclave paper that become much more pronounced, and you know that it was sterile. And every time a pack of needles is used, whatever needles are not used are sent back for re-sterilization. So a lot of care is taken. How The other question is, a trained professional, there's very little risk of, if you're putting needles on the ears and you miss the point by in error, you would just be treating something else. So that if you miss the kidney point by 2 millimeters, you will literally be treating the person for constipation. Which I have seen, I'm smiling because it actually happened with a medical student who visited us and wanted to try the acupuncture. And the nursing assistant doing it missed the point and put it, and he had the urge to go, and he had a very nice bowel movement, he was happy for. All right, so that the other question is, how should a person prepare for an acupuncture treatment? A lot of people come in and they think, well, you have to take all your clothes off, especially women and all of that. No, it's not absolutely necessary. You can, a trained professional acupuncturist can do acupuncture even in winter, sending the needle through the clothing if you wish. So that, yes, in preparation for your session, it is good to educate yourself. It is good to ask questions till you become comfortable so that you know what is involved in the treatment. And in my own practice, I encourage people to ask questions so that, I get a quote from someone here as well. Beautiful. Success is the sum of small efforts repeated day in and day out. And the person credited for that is Robert Collier. And yes, I agree. You know, it is the same advice that is given in recovery. A lot of people, when you think you have to do this for the rest of your life, it sounds overwhelming. But this is why in Alcoholics Anonymous, the formula is really, you avoid the first drink one day at a time. You don't have to stop drinking or using drugs for the rest of your life. All you have to do is not to drink today. And you don't even have to stop for the whole day. You just tell yourself right now, I'm not taking that drink. I'm not taking that smoke. I'm not taking that cigarette or whatever it is you take. And days will grow into weeks, weeks into months, months into years. So again, the converse of the same saying is that, a journey of 1,000 miles begins with the first step. And today, all you have to do is make that first step. You don't have to worry about the second step. Tomorrow never comes. Yesterday is already gone. So that I want to again thank the people who send in the questions. And coming out of this quote, I also want to say to our listeners, and I said this to one of my patients yesterday, that good health is not the absence of illness. All of us, even at birth, we were born with several kinds of viruses and cancer that remain benign in the body, and sometimes it becomes malignant. So that if you are going to wait until you are 100% healthy before you start living, then you'll never live. Nobody can really become 100% healthy. So that in spite of whatever might be your handicap, whatever might be your condition today, might be your illness, might be whatever, depending on your age. As we get older, have the aches and pains. And as I say this, I want to shout out to my eldest sister in San Fernando, Bisubey, who called to say she's not feeling so well this morning. I will talk to her after the program, I promised. And so that at no point we are 100%. So, but I'm saying in spite of that, we should live fully. You know, within our limitations, we live to the best of our ability. And today is the only day we have. So, all of you after this program, if you feel to eat something nice, it don't have to be expensive, you know, that is good for you, do that. If you know, stay away from ill speaking anyone. You know, my formula as usual is avoid doing anything bad. If you get a chance to do anything good, don't pass up the opportunity. Do it. You understand? And if you could help, don't speak about it. One of the problems is when we eventually do something good, we want to be recognized. And when we're not recognized, we get upset. You know? So if we could resist the urge to claim credit for whatever we do, then we will not run the risk of feeling disappointed. And just do good because it is the right thing to do. I can assure you from my own personal experience that once you do good, you cannot escape good happening to you. Sometimes you might think you're doing good and still bad things happening, or what you tend to see as bad. But I have had the experience a lot of times. What I thought was bad was, in fact, an opportunity for me to learn some valuable lesson that has made me a better person today. So, in that regard, nothing is really bad. It depends on how you view it, how you approach it. They're not bad people, they're not problem people. They are people with problems, yes. So that today, I want to wish all our brothers and sisters listening out there, it's a beautiful day out there. And we are very fortunate in Trinidad. We always get spared of these calamities. We say a prayer for all our brothers and sisters of the Caribbean, in Jamaica, in Grenada, in St. Vincent, who suffer the consequences of this recent hurricane that we had, and whatever we can do to assist as a country or as individuals, we should again do the best we can. So, again, I want to thank all of you who have been listening to this program, and feel free to send questions to the text number 7685925. And if you have questions, you can also call me at 671-3040. If you are interested in knowing more about acupuncture, you can call me. Yes, acupuncture has been proven itself to be a successful treatment modality to treat drug addiction. And the most important thing is that you don't get addicted to it. There are no adverse consequences of it, of using acupuncture, unless you go to someone who is not trained and they probably stick you in the wrong place, you know. But aside from that, you know, it is something that has been used even before Christ. We continue to use it. So common sense will tell you there's a lot, there must be something good about this that we still continue to use it today. I have been personally using acupuncture to treat my patients since 1992 with very successful results. So thank you all again, and see you all next Thursday. Same station, same time, 9 a.m. on Thursday, Addiction and Recovery. And you can source this program on YouTube and Facebook in a short while. Thank you very much.